Hi everybody, Dr. Bryton here for Two Tip Tuesday. Today we're going to be talking about DIY, do-it-yourself dentistry. First things first, do it yourself. It's kind of a cool fad going on right now. You can figure out how to do a lot of things yourself. You can figure out how to film a Two Tip Tuesday video all by yourself on your cell phone. That's what I'm doing. But do-it-yourself dentistry, that's a different monster. And that's something that I want to give a firm warning to. A lot of people first might go, well, what's the problem? Well, most people probably aren't going to drill into their own tooth. All right, they're not going to do their own cavity filling, that sort of thing. But the do-it-yourself impressions, sending to a company that makes an orthodontic appliance or some sort of occlusal appliance, something you wear in your teeth, that actually can be quite harmful. And a lot of people don't suspect that. But let me explain why. Let's say you take your own mold. At first you might think, well, it's not bad. I just got an impression of my teeth. You've probably had an experience where you've bit into a rubber mouth guard for sports, so you think, it's not much different. It is, though. If that mold is slightly off, you send it to the lab, whoever's manufacturing your appliance, and clearly they've never seen you before because you're sending it off. They cannot look at that and go, oh, they took the wrong mold. Now, we can, we do with our labs. We literally correspond back and forth if we've got an incorrect mold. But they fabricate your appliance, they send it back. Well, that appliance is now meant to fit a mold that was taken on teeth incorrectly. And it can cause your teeth to maybe shift a little bit. At first you say, well, I don't want my teeth to shift. That would be bad because it looked different. But bigger than that, if it causes your teeth to shift, it actually increases the development of gum disease. It's harmful. It's very harmful. For those of you that tuned in to Two Tip Tuesday, you're very much aware. Gum disease, periodontal disease, is associated with 2 to 3 times increase for heart attack, stroke, increased risk for diabetes, cancers, Alzheimer's, and it can come from an appliance that's made incorrectly. That's why do-it-yourself dentistry is very dangerous. In addition to that, when people make these appliances for you and they don't know that they're made incorrectly, and quite frankly, if you're making your own impressions, most times you're probably not taking them accurately. It also can shift the teeth and not just cause gum disease, but it can also cause them to hit incorrectly. And when they're hitting incorrectly, it causes issues with your jaw joint. It causes issues with the muscles. We see an increased risk for migraines and major headaches. The kicker with that is most people don't associate it with the appliance that they got. So not only are they harming themselves with it, they don't know that's what's harming them. That's also not good. These are major issues with do-it-yourself dentistry. Again, I'm not talking people drilling on their own teeth. Most people would agree that's not a good idea. But some of these other things that people think, I bet I can do that, can be very, very harmful. And not just to your oral health, but to your systemic health. I want to make sure I give this firm warning because it needs to be said. The American Dental Association has come out against it. Most dentists that you talk to will look at you and say it's a really, really bad idea. But for some reason, people are continuing to do it. And so I want to make sure that people are aware it can harm you. So that's my Two Tip Tuesday. I hope it's helpful. If you have questions ever about do-it-yourself dentistry, please contact me first. I want you to be safe. Thanks so much for tuning in. Again, any questions, please comment below. We'd love to respond to you. Or like I said, call us or email us. Thank you so much for tuning in. Hope you have a wonderful Tuesday and a great rest of your week. Thank you.